Okay, let's get started. My name is Christian Engstrom. I'm CEO of Eviabio, where we are delivering better and safer therapeutics enabled by all natural cryopreservation. So today we're partnering with cell therapy developers to improve potency of their drugs and eliminate toxicity, mainly DMSO, dimethyl sulfoxide. Our lead client is targeting glioblastoma. Go on the next slide here. So a bunch of technical information here. What it says is that dimethyl sulfoxide, the standard reagent used in cryopreservation, hurts patients, creates reduced potency, and also has a tremendous amount of issues within the supply chain. It's a petroleum-based industrial solvent that we're putting into humans, and it's the best choice that we have today. Eviabio's all-natural solutions solve all these problems. So today, as I mentioned, we are targeting cell therapy developers. We have an active co-development. We've generated $220,000 in revenue, really the last 6 months we've gotten started. And we are targeting the top 100 cell therapy developers. There's other places we can go with this. We have a platform technology. We think the other markets are bigger: cell banking, apheresis, fertility, huge markets that use cryopreservation. However, cell therapy gets us first into human, and that's really important. We can talk more about that later. You may know cell therapy is booming. We are a pick and shovel company that will produce better results for the developers. So on the bottom left, you'll see just how integral cryopreservation is to the supply chain in cell therapy. And then to the bottom right, it's a $1 billion opportunity in the cell therapy space alone. So today we're asking for $500,000 in seed funding. We have revenue. We want to go out and do a bigger raise next year, Q4. We want to put some more data out in the market with top developers. We are patented. We're de-risked. Our founder is Allison Hubble. She's the world's leading cryobiologist at the University of Minnesota. She has studied how to mitigate DMSO for the last 25 years and has come up with a solution. She knows what she's doing, and our pipeline is full because the market knows she knows what she's doing. So we have a relatively low regulatory bar as well. So to the left there, that guy's not important, but Allison, I bragged about her a little bit. She's just wonderful. We have a female-founded University of Minnesota spin-out that's going to change cryopreservation. And in the middle there, we have Brian Pulte-Love. He is maybe the premier deal maker in the cell therapy space. He's our board chairman. He knows what Allison has, and we have a team around her to take this to market. So we ask you for your support. I'm out of time. Thank you very much.
Thank you for your presentation. I've got 2 questions. I'm wondering, are there specific cell types that are more vulnerable to DMSO toxicity? Or
Absolutely.
Applications of those cell types?
Yep, and the cell therapy developers are coming to us with the cell types that are more sensitive to DMSO. So we're just working on an NK cell application. T cells are very vulnerable. Lots of variability in batch to batch performance for potency. So you have these patients, if you've ever been to a cell therapy infusion floor, it smells like garlic. The patients have burning sensation, they're vomiting. It's a terrible place to be. These really sick people are getting sick from the medicine that they're getting. And we're going to be able to eliminate that while improving the potency.
To the extent you can you tell us a little bit about the actual product?
Yeah.
Where it's come from?
Yeah, she studied trees. Allison studied how trees survive Minnesota winters. Actually, she was looking out her office at the University of Minnesota. And it turns out trees absorb sugar alcohols, amino acids that reinforce the cellular membrane, push water out, and drop the freezing rate. So the tree bark that you feel kind of spongy, that's what's going on. So what she did is she went and got $3.5 million in NIH funding, proved it out by cell type. She's published, peer-reviewed, and really de-risked this thing. So now it's about taking it to market. We think we have some work to do on our IP. We have very broad general IP with the University of Minnesota. It'd be nice to get it honed in on applications. And for that reason, we are co-developing right now to build out the case study, to build out our market security, We can move this to a kit though. So T cell kit, NK, iPSC, MSC, we have those developed already. And they're outperforming something called CS10 by BioLife. That's our competitor. We're kicking their butts right now. So we're putting that package together, and we're looking for partners to scale.
So Christian, when do you think you'll initialize your real commercialization of?
So I think it could be argued our strategy right now is a commercialization strategy. We are co-developing, optimizing, and licensing. There's a service agreement, a supply agreement, and a royalty agreement that goes with that license. We're moving into our negotiations with our lead right now, which is a top 50, the name you know. Everybody we're working with are names that you would know in this space. And that is, we see each license being worth 1 million. So in the next 4 years, we want to put 20 licenses into the market, generate a $20 million business. And we can get into why it's worth $1 million per license, but we've done our homework on that. And from there, we'll have a kit business that we can push out to universities, research hospitals like Mayo, so they can begin doing work on their own projects. Thank you, everyone.